Well, good morning, Long Beach. We are, of course, giving an important briefing today. And I know that a lot of folks right now, as we are very concerned about where things are at with COVID-19 as it relates to spread across our city and our country. And I will be joined today by Dr. Anissa Davis. The two of us are really also just heartened by the opportunity to share with everyone our vaccination plan for the city of Long Beach. I want to just give a few facts about where we are at and then move right into our vaccination plan. It's important to know that just within the last couple of hours, the state has announced that we have 7.7% left on ICU capacity across our Southern California region. That is alarming, and the number of ICU beds available in the region and both in Long Beach continue to decrease. It's also important to know that if you are a Long Beach resident, you of course can get treatment or assistance at a hospital outside our city, and the vice versa is true. Folks from Orange County, from Lakewood, from across the county also come to our hospitals for treatment. So we are all in this together. I will also note that yesterday it was announced that we are hitting record numbers of daily deaths across the country. In fact, we are losing more people now daily, if you look at our numbers from yesterday, than 9/11. This is happening every single day, and we're having 9/11-like events now on a daily basis. That is where we are today as a country, and we're losing Long Beach residents also day after day. So the COVID crisis remains serious, and it remains the single biggest threat to life that we have faced in our city, and the single biggest threat that remains as we move forward. Now, what brings us hope is that we know that in 2021, we are going to defeat COVID-19. And we have, as a team, and our health department has been working diligently to put together a strong, responsible, and equity-based vaccination plan. Our health department is managing the vaccination process, and we'll be following, of course, the CDC guidance and the advisory committee on immunization practices as other jurisdictions are following across the country. I want people to know that because Long Beach has its own health jurisdiction in the Long Beach Health Department, we will be managing our vaccination distribution process. We also know that our friends at LA County Health are handling vaccination for a vast majority of the cities across the county, but we will be handling our process here at home. I'm also happy to announce today where we are with the process and what the timing actually looks like. Let me begin by saying that we will be receiving in just these next few weeks both the Pfizer and Moderna vaccine. And I'm happy to report today that we have the infrastructure, the cold storage, and the distribution mechanisms in place today to disperse the vaccine successfully. Now, as you've heard, both of these vaccines require 2 doses. The Pfizer vaccine has to be spaced 21 days apart, and the Moderna vaccine has to be spaced 28 days apart. So 21 for Pfizer, 28 for Moderna. We are getting both. I want to start with the Pfizer vaccination. Before the end of this month, so in just these next couple of weeks, we will be receiving approximately 3,900 doses of the Pfizer vaccine. And those shipments are now on their way. Now, those 3,900 doses are for 3,900 people, because we know there is an additional second dose that, of course, will come for folks to get fully vaccinated. Those vaccinations will begin likely here before the end of this year. In addition to the 3,900 initial doses of Pfizer vaccine that we're going to receive, we're also expected up to 11,600 doses of the Moderna vaccine in the next few weeks. Now, these vaccines will be arriving soon after the Pfizer vaccinations, and we expect to receive those in early January. Both the 3,900 Pfizer vaccination process and the 11,600 Moderna process I'm going to explain in a minute. But that is the first shipment of vaccinations that the city of Long Beach will be receiving. When we continue to receive the vaccines, and will continue to do so all throughout 2021, and of course, we want to ensure that folks that want to get vaccinated, but let's be clear, not everyone will be vaccinated at the same time. And we will be in a vaccination process all throughout 2021. It's also important to note that the CDC and all of the agencies at the federal government are putting forward important safety measures, and the testing has been put in place to ensure that they're safe for the community. Now let's talk about how our phasing is going to work. Essentially, there are two major phases here in our city that we're going to follow. So there is phase 1, and then there is phase 2. Now, phase 2 is the general public. Phase 1 is much more of a specified vaccine plan that lists people in order as we go through the shipments that come in. I'm going to go through those in just a minute. But it's very important for folks to know that the order of these vaccinations and who gets them has been developed by our Long Beach Health Department in consultation with the CDC and the federal guidelines about who gets vaccinated first and in what order. I want to be also clear as we go over these vaccinations that what we can all agree on is the first folks that should be vaccinated are the folks that need our support, our medical workers, our essential workers, and it's been committed that way through the work happening at the federal level. So let's talk about this first phase. Within phase 1, essentially there are 3 phases, A, B, and C. So phase 1, there's A, B, and C. We're going to spend most of our time right now talking about A. And that A actually also has 3 tiers, and in order, I want to go through those right now. So phase 1A is basically our healthcare. Phase 1B is essential workers. And phase 1C is seniors over 65 and they're at high risk. And let's talk about the order of how those happen. Let's talk about phase 1A. In phase 1A, which is essentially happening now. So phase 1A will begin in the next couple weeks when those initial vaccinations come in. Phase 1A will have access to the vaccine first. And these are our hospital workers in Long Beach. We'll be providing direct vaccinations to Long Beach Memorial, Miller's Children's Hospital, St. Mary's Medical Center, and College Hospital will all get the vaccine first. These, of course, are the folks, the doctors and the nurses and the medical personnel that are working in our hospitals and directly interacting with patients. Those vaccinations to those folks watching today are on the way. In addition to them, within that, in that first phase, in that group A, we'll also be vaccinating our residents and staff at our acute care and skilled nursing facilities. We know that earlier this year, we had devastating outbreaks at our skilled nursing facilities. Our vaccinations for our skilled nursing facilities and our acute care system are also in this first batch of wave of vaccinations that are coming. In addition, in this group A, we have our emergency medical techs and those at our dialysis centers will also be given the vaccine, as well as paramedics and EMTs. So, just to review, we know that in phase 1, Group A is everyone I just discussed: our hospital workers, our paramedics and EMTs, our residents and staff at our acute facilities, and our medical technicians at dialysis centers will all be given the vaccine first. To have enough vaccine doses to get through that group, Group A, is going to take us months into 2021 because of the amount we're getting in. So imagine the first quarter of 2021, all of those folks will be vaccinated within that order. We hope that also early in 2021, we'll also be getting to the second part of that Group A, which they're calling the second tier of 1A. So Tier 1 and Tier 2 of 1A. This group includes ward and care facilities, home health care, in-supportive services, public health field staff, workers at the Long Beach Health Department that are directly interacting with the public. All of those folks will also follow that first group we just discussed. And after those folks, within the same Group 1A, we will have our dentists, our specialty clinics, lab workers, and many workers within our pharmacies. So, all the folks I've just described, we hope over the course of the next few months ahead, will all go through the vaccination process. And we are working directly with all of those hospitals, clinics, dental offices, our paramedics, obviously they're part of our city, our specialty clinics, our ward and care facilities. For all those folks, we are moving forward quickly. We are now, of course, in 2021. And all of those folks are in those first few months as more and more vaccines come in. I want to now discuss within this category of that we're discussing, there is the next phase, which is called 1B. 1B are our essential workers and that are not healthcare related. So if for our essential workers, if you are in education as a teacher, a grocery worker, you work at Long Beach Transit and our transit systems, you work in utilities, you are a police officer or other kind of public safety officer, those vaccinations will come in 1B, all of those essential workers. We're going to work to ensure, of course, that they get vaccinated soon after all the healthcare workers. And we're hopeful that all of that vaccination process will, of course, start within these next few months and going into the spring. In Group 1C are going to be other seniors that are over 65 and that are high risk and that need additional support within the community. Now, all of those folks that we just discussed are what we're calling phase number 1. Our hope, and I say hope because the timelines can change, but our hope is that everyone that we just described will be vaccinated throughout the spring. And we expect and hope that in late spring or early summer, we will have enough vaccination to start what we're calling, of course, phase 2. Phase 2 is the general public. Now, we understand that a lot of folks want to get vaccinated today. And we would love to have enough vaccine to vaccinate everyone in the next couple months. But the truth is that we have to vaccinate as we go and as we get vaccinations coming in. So starting in late spring and throughout the summer, many of our testing centers that are currently in operation will be converted to mass vaccination centers across the city. And so you'll be able to drive up like you do for a test and instead of getting a test, or you can still get one, you will also get the vaccination for COVID-19. So we are ready for the vaccine. We have the infrastructure and the staffing in place. But the most important thing we can do today is understand that we have not beat this virus yet. Just because vaccinations are on the way doesn't mean we can stop wearing a face mask or not be careful. But every single person that gets vaccinated, starting now in just a couple weeks, will add to the strength of our city and community, and more and more and more people will become immune, and we'll be able to take this virus on in a much stronger way. And so that is hopeful and something that we are excited about. With that, I'm going to turn this over to Dr. Anissa Davis, who's going to give some remarks, and then we will be available if there are any questions. So thank you.
Thank you, Mayor. Good morning. I want to spend a few minutes providing some additional details about our plans for the city's distribution and dispensing of the COVID-19 vaccine. Today, the FDA will complete the review of the emergency use authorization for the Pfizer vaccine. As Mayor Garcia shared, we will be receiving 3,900 doses of the Pfizer vaccine in the city of Long Beach with our first shipment, which is anticipated to begin shipping on December 14th, with more anticipated to ship the following week. From there, we will work with local partners, including hospitals and academic institutions, to begin distribution and vaccination. Starting first with populations where immunity will have the greatest impact on preserving lives and health of our community. As Mayor Garcia noted, we will be receiving further allotments following the initial 3,900 doses. Adding to the additional shipments of the Pfizer vaccine, the Moderna vaccine is scheduled to be reviewed by the FDA for emergency use authorization on December 17th and should begin shipping the following week. So this really is just the first of many rounds of vaccines that we will have to distribute in Long Beach. The Advisory Committee on Immunization Practices, or the ACIP, has given guidance on prioritizing those who are at highest risk of infection, like our hospital workers and our frontline workers, and later expanding to other essential workers, adults over the age of 65, and those with underlying health conditions. This prioritization, established to benefit the entire community, is broken down into a set of phases, subphases, and tiers. Again, the first groups to receive vaccine will be those in phase 1, which includes healthcare personnel and long-term care facility residents. The number of people in this group is larger than the quantity of doses we will receive with the first shipment, so phase 1A is further broken down into the 3 tiers that you just heard about. Tier 1 includes acute care and skilled nursing facilities, paramedics and EMTs, and dialysis centers. Tier 2 includes intermediate and home health care, community public health field staff, and primary care clinics. And Tier 3, which is most other healthcare settings, including laboratories, dentist offices, and pharmacies. When these groups get vaccinated, it not only protects them, keeping them available to support the medical needs of our city, it also protects everyone who needs to receive care from them. As more vaccines are received, they will be offered to other essential workers in phase 1B. Then phase 1C, which includes high-risk populations of adults over the age of 65 and adults with high-risk medical conditions. The population at large will receive vaccine in phase 2. This form of triage, which is being adopted across the nation, is necessary to offer additional protection to those at highest risk of death from COVID-19, as well as guarantee that medical professionals, particularly those who work in intensive care, can continue providing for the entire community. Over the next few months, we will be distributing vaccine to our city partners to make sure that those in phase 1 can get vaccinated. We will then begin our city-led dispensing operations, first by holding points of dispensing clinics, or pods, for essential workers, and then later for the general public. It's been mentioned before, but vaccine distribution and dispensing is part of the normal functions of the Long Beach Department of Health and Human Services. Our public health emergency management team and immunization coordinator have been training and exercising to prepare for mass vaccinations for years. Every year, including this one, the health department, including the public health emergency management team, the immunization clinic team, and clinical staff, along with nursing students and the American Red Cross, practice for emergency vaccine distribution by conducting mass vaccination events in the city during the flu season, when we provide free drive-through flu vaccines. Our record is 2.5 people vaccinated per minute over 4 hours. That's a total of 600 people that we're able to vaccinate in 4 hours. Additional pods or points of dispensing exercises are done in partnership with area emergency responders, such as fire, police, hospitals, and regional health partners. And we dispensed vaccines for thousands of residents in response to H1N1 years ago. So my point is we've been preparing for this for a while and we're ready. We ask the broader community to be patient as we work with our partners to distribute vaccines for those at highest risk and with highest impact, a strategy that benefits all of us. While you are waiting, know that it is as important as ever to continue taking the necessary precautions to limit the spread of COVID-19 in our community. As both the Pfizer and Moderna vaccine require 2 doses, 21 to 28 days apart, to maximize effectiveness, we are still extremely concerned about the boom in positive cases and the demand put on ICU staff in our community. So stay at home as much as possible. Leave your home only as necessary to access and provide essential services. If you are sick, isolating, or in quarantine, this is even more urgent. Wear a face covering whenever you leave your home. Avoid close contact with anyone you don't live with. Wash your hands, disinfect frequently touched surfaces, and avoid touching your face. In closing, I just want to say I know we've been at this a long time, and we are so hopeful about the positive impact of vaccines, and they will have a significant positive impact. But we're not out of the woods yet. We need to hang in there and stay with this for a while longer. Thank you.
Thank you, Dr. Davis. We have one question from the media. Question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Ooh, it's hard to hear him.
Yes, hi. This question is regarding ICU and hospital capacity. In the spring, we saw that we had set up cots in the convention center. We had the Mercy ship come. We haven't seen that now. Is there a reason why we haven't started setting up for overflow capacity? And when could we possibly start seeing that?
So we are setting up. The state has been really active in discussing and managing and developing surge capacity. So there's a lot of ongoing discussions. And I think that you will start to see some alternate care sites being set up in the region and throughout the state.
All right, that concludes questions from the media. We will now move on to Spanish interpretation.
That's it? Is that what he said? Okay.
Buenos días, gracias por acompañarnos en nuestro comunicado de prensa de hoy jueves 10 de diciembre. En lugar de nuestro tradicional informe de COVID esta semana, hoy queremos compartir con ustedes el trabajo que hemos estado haciendo para prepararnos para administrar la vacuna COVID localmente. Muchos de nosotros hemos estado esperando ansiosamente la vacuna y la buena noticia es que vamos a comenzar con las vacunas aquí en Long Beach antes de fin de año. Nuestro Departamento de Salud está administrando el proceso de distribución de vacunas y seguirá la orientación de los CDC y del Estado. El alcalde García quiso mencionar y recordar a todos ustedes que en la región del sur de California la disponibilidad de camillas en cuidados intensivos ha bajado drásticamente a solo 7.7% de disponibilidad. Estamos perdiendo todos los días la misma cantidad de personas que perdimos el 11 de septiembre. Tenemos nuestro propio departamento de salud que estará distribuyendo la vacuna. Como hemos mencionado anteriormente, somos parte del condado, pero la ciudad de Long Beach tiene su propio departamento de salud que se estará encargando de la infraestructura para recibir, almacenar, distribuir y dispensar la vacuna. Recibiremos varios envíos de la vacuna de Pfizer y de Moderna. Ambas vacunas van a requerir 2 dosis. Con la vacuna Pfizer, las dosis deben espaciarse de 21 días y con la vacuna Moderna requiere que la dosis se den 2 con una diferencia de 28 días. Primero vamos a recibir 3,900 dosis de la vacuna Pfizer y estos envíos llegarán muy pronto. Es probable que las vacunaciones con la vacuna Pfizer comiencen antes de fin de año. Otra cosa que queremos mencionar es que los lugares que ahora están para la prueba de COVID-19 se convertirán en localidades de vacunación. También esperamos hasta 11,600 dosis de la vacuna Moderna en las próximas semanas y podremos comenzar la vacunación con esta vacuna empezando en enero del 2021. Esta es solo la primera ola de vacunas que recibiremos. Continuaremos recibiendo vacunas hasta que todos en Long Beach que quieran vacunarse estén vacunados. Pero queremos ser muy claros, no todos se van a vacunar al mismo tiempo. Habrá fases en el plan de vacunación general. Estas fases son determinadas por la CDC y el Comité Asesor sobre las Prácticas de Inmunización. La fase 1A va a incluir el grupo que tendrá acceso primero a esta vacuna, que son los trabajadores de nuestros hospitales aquí en Long Beach. Esto incluye Long Beach Memorial, Miller Children's Hospital, St. Mary's y también College Hospital. Ellos estarán recibiendo esa vacuna primero, junto con los residentes y personal de centros de cuidados intensivos, psiquiátricos y de enfermería especializada. Y después voy a hablar un poquito más en detalle sobre los siguientes pasos de esas personas, de quienes van a recibir esa vacuna. Long Beach está lista para la vacuna y tenemos la infraestructura y tenemos el personal y también el plan para poder hacerlo. Hoy nos acompañó la doctora Davis, que es la oficial de salud aquí para la ciudad de Long Beach, que ofreció más detalles sobre la distribución de la vacuna y nos informó que a finales de esta semana la FDA completará la revisión de autorización de uso de emergencia para esa vacuna de Pfizer, que vamos a recibir, como mencioné anteriormente, 3,900 dosis aquí en la ciudad de Long Beach. Se espera que la vacuna se mande el 14 de diciembre y que envíen más las semanas siguientes. A partir de ahí, trabajaremos con socios locales, incluidos hospitales e instituciones académicas para comenzar a distribuir la vacuna, comenzando primero con las poblaciones donde la inmunidad tendrá el mayor impacto en la preservación de la vida y la salud de nuestra comunidad. Estaremos recibiendo más asignaciones luego de esa dosis inicial de 3,900 dosis. Como mencioné anteriormente, se requieren 2 vacunas para Pfizer o Moderna. Además de los envíos adicionales de la vacuna Pfizer, la vacuna Moderna está programada para ser revisada por el FDA para uso de emergencia el 17 de diciembre y se comenzará a enviar a nosotros el 21 de diciembre. Así que esta es solamente la primera de muchas rondas de vacunas que tendremos que distribuir aquí en la ciudad de Long Beach. El Comité Asesor sobre las Prácticas de Inmunización ha brindado orientación sobre cómo priorizar a aquellos que están en mayor riesgo de infección, como nuestros trabajadores hospitalarios y otros trabajadores de primera línea. Y luego vamos a expandir a otros trabajadores esenciales, adultos mayores de 65 años y con condiciones de salud subyacentes. Esto está puesto para establecer, para poder beneficiar a toda la comunidad. Se divide en un conjunto de fases, subfases y también niveles. Nuevamente, en más detalle, los primeros grupos en recibir la vacuna serán los de la fase 1A, que incluye personal de atención médica y residentes de instalaciones de cuidado a largo plazo. La cantidad de personas en este grupo es mayor que la cantidad de dosis que recibiremos en el primer envío, por lo que la fase 1A se divide en 3 niveles de los que acaba de enterarse. El nivel 1 incluye centros de cuidados intensivos y de enfermería especializada, paramédicos y técnicos de emergencias médicas y centros de diálisis. El nivel 2 incluye atención médica intermedia y domiciliaria, personal de campo de salud pública, comunitaria, clínicas de atención primaria. Y al final, el nivel 3 es la mayoría de los demás entornos de atención médica, incluidos laboratorios, consultorios de dentistas y también farmacias. Cuando estos grupos se vacunen, no solo nos protege a ellos, pero también a aquellas personas que están recibiendo servicios de ellos. A medida de que se reciban más vacunas, se ofrecerán a todos los trabajadores esenciales en la fase 1B. Y eso, la fase 1B es trabajadores esenciales no médicos, como aquellos que trabajan en utilidades, policía o quizá un chofer de transportación pública. Luego la fase 1C, que incluye poblaciones de alto riesgo de adultos mayores de 65 años y adultos con afecciones médicas de alto riesgo, antes de ser finalmente ofrecido a la población en general en la fase número 2. Esta forma de triaje que se está adoptando por todo el país es necesario para poder ofrecer protección adicional a las personas con mayor riesgo de muerte por COVID-19, así como para garantizar que los profesionales médicos a quienes necesitamos, particularmente aquellos en esos cuidados intensivos, puedan continuar brindando todo a la comunidad. Durante los próximos meses distribuiremos vacunas a nuestros socios de la ciudad para asegurarnos de que aquellos en la fase 1 puedan vacunarse. Luego comenzaremos nuestra operación dirigidas por la ciudad, primero con puntos de clínicas de dispensación o PODs, como lo conocen aquí, para trabajadores esenciales y luego para el público en general. Se ha mencionado antes, pero la distribución y dispensación de vacunas es parte de las funciones normales del Departamento de Salud y Servicios Humanos aquí en la ciudad de Long Beach. Nuestro equipo de manejo de emergencias de salud pública han estado entrenando y haciendo ejercicios para prepararse para vacunaciones masivas durante años. Cada año incluido ese equipo practica la distribución de vacunas de emergencia mediante la realización de eventos de dispensación masiva en la ciudad durante la temporada de gripa, que es anualmente. Los ejercicios adicionales de punto de dispensación se realizan en asociación con los servicios de emergencias del área, como bomberos, policía, hospitales y socios regionales de salud pública. Y dispensaremos vacunas a miles de residentes en respuesta al H1N1 hace algunos años. El punto es que nos hemos estado preparando para esto por un tiempo. Estamos preparando y ansiosos por comenzar a distribuir vacunas contra COVID-19 a nuestros socios y eventualmente a distribuirlas al público en general de manera eficiente y equitativa. Pedimos a la comunidad en general que tenga paciencia mientras trabajamos con nuestros socios para distribuir vacunas para las personas con mayor riesgo y con mayor impacto. Una estrategia que nos beneficia a todos aquí en la ciudad de Long Beach. Mientras espera pacientemente, recuerde que es tan importante como siempre seguir tomando las precauciones necesarias para limitar la propagación de COVID-19 en nuestra comunidad. Dado que tanto la vacuna Pfizer como también la Moderna requiere esas 2 dosis con la diferencia de 21 días o 28 días para maximizar la efectividad, todavía estamos extremadamente preocupados por la cantidad de los casos positivos y la demanda del personal de cuidados intensivos en nuestra comunidad. Mencioné anteriormente que estamos ahora al 7.7% de disponibilidad en esas unidades de cuidados intensivos. Pedimos, por favor, que se quede en casa lo más posible y salga de su casa solo cuando sea necesario para acceder y brindar servicios esenciales. Si está enfermo, aislado o en cuarentena, eso es aún más urgente. Continúe usando una cubierta facial cada vez que salga de su casa y evite el contacto cercano con cualquier persona con cual no viva. Lave sus manos, desinfecte las superficies que se tocan con frecuencia y evite tocarse la cara. Sabemos que hemos estado en esto por mucho tiempo y estamos muy esperanzados sobre el impacto positivo que traerá las vacunas, pero todavía no estamos fuera de peligro. Por favor, cuídense. Esto es todo por hoy. Muchas gracias por acompañarnos. If you've joined our press briefing during our Spanish translation portion, please visit our Facebook or Instagram page to see the beginning of the briefing with Mayor Garcia and Dr. Davis. We thank you for joining us.